are going to get started. I want to welcome you all. This is our second Catholic Charities Lunch and Learn of the year. We have one more scheduled for the fall. It'll be up north in Ashtabula. We're not sure of the location or topic yet. So if you're on our social media or you get our emails, there'll be more information probably by the end of summer on that. We have resources up here on this table. Feel free to help yourself to any of those resources. And we also have evaluation postcards on each of the tables. If you scan that QR code on the postcard and go through the survey, you'll be given a code at the end of the survey. If you write that code on the postcard and bring it up to this table, we're doing a drawing for a door prize, so you'd be eligible for the door prize. Before we begin with our speakers, I would like to ask us all to pause for a moment for prayer. In the name of the Father, and of the Son, and of the Holy Spirit, amen. Loving and compassionate God, we thank you for gathering us here today. As we enter into this time of learning and reflection, open our hearts and minds to your wisdom. Help us to see the dignity and sacredness of every human life, from its beginning to its natural end. Grant us the courage to face difficult questions with faith, love, and hope, and to accompany others with compassion and respect on their journey through illness, loss, and grief. May the teachings of our Catholic faith guide us, and may the Holy Spirit be present in all that we share and discuss today. Bless our presenters, our conversations, and the food we will share. We ask this through Christ our Lord. Amen. If at any time during the presentations you want to get up to get something to drink or to get more food, please help yourself. We have plenty. It's my pleasure to introduce our two speakers for this afternoon. Deanna Ford, who is the Mission Director at Mercy Health Youngstown. Deanna is a lifelong resident of Poland, Ohio, with more than 35 years of experience in healthcare. She spent 17 years as an emergency department RN and 7 years as an ICU nurse manager. She currently serves as the Mission Director at Mercy Health Youngstown. Deanna earned her registered nurse diploma from the Sharon Regional School of Nursing in 1990, her bachelor's in nursing from Youngstown State University in 2002, and a master's of nursing in 2017, and a Master of Arts in Healthcare Mission from Aquinas Institute of Theology in St. Louis, also in 2017. She serves as the president of the Board of Directors of Catholic Charities Regional Agency and is deeply passionate about community service. Deanna is active with the Dorothy Day House in Youngstown and supports initiatives like Nonviolence Week and the Martin Luther King Committee. She is the proud mother of 2 adult sons, Ryan and Tyler, and daughter-in-law, Stephanie. She is also a doting grandmother to 3 grandchildren, Elizabeth, Aurora, and Harmony, and shares her home with her cat, Sushi. Aww.
Who's that girl?
Everybody awes over the cat.
Yeah.
We also have with us Nancy Voitis, who's the Executive Director of Catholic Charities Regional Agency, where she has been she's been with the agency for 25 years this year, and has been in the executive director position for many of those years. She has held the position for 25 years. As I said, she's a licensed independent social worker holding a master's degree in social work from the Ohio State University. Before joining Catholic Charities, Nancy worked in community outreach and social work with the organization that has since become Mercy Health. She has served on the board of the Mercy Health Foundation, Mahoning Valley, and remains actively involved in the community, focusing on homeless services, mental health programs, and housing initiatives. Nancy has a special personal and professional interest in grief and grief response. She lives in Columbiana with her husband, Ron, to whom she's been married for 38 years. They just had an anniversary on Friday. And in her free time, Nancy enjoys golfing, jogging, and reading.
And her dog Charlie.
And a dog named Charlie.
We had to get the dog.
Okay, come on. So with that, I'll turn it over to Deanna and Nancy.
All right, so we're going to do a sound check. I'll probably talk a little louder than my normal voice. How does this sound? Talking to that, Michael? Okay, very good. If you want to pull a chair up or come closer, that's okay too. So, as you heard, my name is Deanna Ford. I work at Mercy Health as mission director. I wear many hats. One of those hats is leading the Youngstown market in clinical ethics. It's a passion of mine, and I can draw on my clinical background in that work. This is really important. You see the topic, right? I want to tell you all, we preface this by saying these are difficult topics. End of life and grief. We've all experienced it. Each experience is unique. And to say these things change you or affect you in your life and the life of your loved ones is an understatement. Some of what we will touch upon today will spark some fresh, some old feelings about people who have gone before us. Please know this is a safe space. I can already feel it. I've met 10 people today. And I trust that many of you can and will relate to what feelings may come up. And if you have to excuse yourself or step out, that's okay too. So I think what I ask is that we take care of each other through this presentation. Sound good? Okay. So for today, just an overview. I'd like to do a brief overview of the guidelines we use in Catholic healthcare. They're called the ethical and religious directives, just to touch on those, and some things I see as valuable as we talk about caring for patients and families in the hospital setting. Oh, right, okay. So, we all have a story, and these are my parents. Rollin, also known as Butch Dunn, and Mary Jo Dunn, who lifelong residents as well, who have both passed on. This is sort of my story with my parents. Both have died. My mom died in November of 2020, the year of the onset of COVID. My dad died in November of 2022. And for both my parents, my siblings and I did agree for hospice care. My mom for her last few days, my dad for his last few weeks. For my dad, at the age of 79, he experienced physical and mental decline and suffered with a cancer diagnosis that was treatable over time. However, he never regained his appetite, continued to lose weight, became more confused, agitated at times, and much more immobile. His neighbors knew him well because he had frequent falls, but they were always there to help. It was becoming much more difficult for his wife to take care of him at home. And to tell you a little bit about my dad, one person probably remembers him. He was very good friends with another person in the room's dad, Deacon Still. They grew up together in Camel. But he was loud. He was boisterous. He loved to talk. He loved to be with people. He loved to laugh. Sporting events, conversation, family, eating. This was my dad. So all of those things he could no longer do. He didn't enjoy surgery, hospitals, blood draws, or waiting in the hospital. I think that's where he was the most unhappy. So it was tough because we could have made decisions that would have, maybe gave him some more time with his body on earth. Maybe fed him through a feeding tube, which is okay. He could have been cared for in a nursing facility, which is okay too. But we knew my dad, and his wife knew my dad. And I think he would have haunted us if we would have made those choices for him. Now, mind you, we're going to talk a little bit about whose choice is this. And really, it's his choice through us. We're his surrogate decision maker when we're in the hospital, right? So we all have a story. We're all dealing with it or have dealt with it. Sometimes it's an end-of-life situation that we are approaching or something that has happened acutely or rapidly. But it's all leads to grief, as we'll talk about. As mission leaders at Mercy, we look to ensure we stay true to our Catholic identity. One of the ways we do this is by learning, living, and educating about our ethical and religious directives, which we will touch on today. One of these commitments in our ministry is ensuring we are prepared to provide holistic care to our patients. This means we must consider the mind, body, and spirit. You can pull them all up. So, just a little bit. This is a document we learn about, especially in the mission role. But it's a document that comes from the Catholic bishops. It is U.S. specific, and there are 6 sections. Was there more? And I'll just highlight a few. And really, if you were to read this document, which is available to everyone online on the United States Conference of Catholic Bishops website, our focus is a high focus on the dignity of the human person, right? From life to death. And it does provide us some guidance on certain moral issues. So next. Okay. So these are the different parts. We in Catholic Healthcare, if you look at the document itself, I have a copy. They used to be free, now they're $5, but you can download. So it talks about what is our social responsibility, what do we do when it comes to the pastoral and spiritual responsibility, when we take care of people in our facilities, what is the professional-patient relationship, and so you can see, and we're going to touch on a couple of these during our talk today. So, I'm curious, has anyone had the experience of seeing a loved one in a situation, in a critical care situation? This might look what it looks like, okay? So something I got from the directives that I thought was important, and this is why we have the directives, because this is what I call, because we can do it, should we do it, right? And when we go back to my dad, we could have certainly extended his body's life on earth, right? But we talk about this from an ethical perspective, always using what the patient's preferences are, and maybe through the family, talking about that. But Catholic healthcare does not say that we have to go for everything. It doesn't mean that we have to say, yes, these are the decisions. Of course I'm gonna feed my father. Of course I'm going to make sure that he lives as long as he can. But the Catholic directives, the ethical and religious directives, does not say that. And it also said sometimes, because we have all of this available, it can lead to expectations that we can't meet. So, one of the things that I'm very proud of when it comes to Mercy Health Youngstown and Mercy Health in general is the fact that we have a very high focus on holistic care, mind, body, and spirit. There are researched peer-reviewed studies that show that patients who have a pastoral visit, it does improve their experience and maybe even their outcomes in health. It's studied. So it's not just, hey, may I pray with you? There's a lot more to that. So, spiritual needs are patient-specific. And then in the ERDs, numbers 10 and 11 in part 2, talk about how we work closely, part 2 especially, or ERD 11, how we do work with our diocese and our local clergy and our local religious folks. We really aim to do that, and so we do that in a way through our chaplains. Something too, our chaplains are very well prepared through their clinical pastoral education, which is, they call them units, 5 units, and they have, I would call it a very rigorous training, and then they're encouraged to become board certified. So they have the ability to talk to people who are going through serious illness or facing end-of-life issues. So they're part of our healthcare team too. Go ahead. So when we look at part 5 in the ethical and religious directives, of course you all know, especially if you're here or maybe raised Catholic, or this isn't unique to Catholic healthcare, but compassion is key, and respect for the sacredness of human life. Something I thought was important here, and we'll talk a little bit about, is that we work very closely with our palliative care services, especially for our patients who are have chronic illness or maybe approaching decisions regarding end of life. I'm just curious, has anyone here utilized palliative care for their own care or for their families? And I have to tell you, it's not a well-known service line, so when we approach people in the hospital, sometimes people aren't sure what we're meaning. The couple things I thought were important to mention is that, we talk about nutrition and hydration, and there is a guidance here within our ethical and religious directives that said, obviously we're obligated to provide food and hydration. But if the body or if the medical condition of the person is not in a state to accept that, or, again, my dad was approaching end of life, we have that decision, and it is acceptable to say no to that kind of treatment at that time. Another thing that comes up is pain control. We're going to talk a little bit about hospice. But yes, it's okay to control symptoms with different medications at the end of life that may not seem normal when patients are experiencing other types of pain. So our families, our patients, even our clinical staff can say, wow, what are we doing here? Are we hastening death? And really we're not. We're alleviating symptoms. We're alleviating anxiety when we're giving those type of relief pit medicines at the end. Next. One of the most important things in when you come into the hospital or as a patient or when you're with your doctor, maybe you have a diagnosis of any kind. Maybe you turned 60 last year and you think maybe you should have something in writing. What are our values and preferences? I talked about my dad, right? He liked to be at sports events. He liked to be in big groups. He liked to talk, engage, have a good meal. So we want to know, when you're in the hospital, what are your values and preferences? And what's even more important, who knows that? Who knows what they are? Have you talked that over with anyone? That's tough. Believe it or not, we see it a lot in the hospital setting, where we have to approach maybe a significant other, a family member, an adult child, and ask them, if their dad or mom or family member doesn't have the ability to make a decision, well, what would they have wanted? And they say, oftentimes, we never talked about it. Am I good on time? Okay, I'll wrap it up. And why don't we talk about it? I didn't want to talk about it with my own parents. I'll be very honest. It's uncomfortable to even think in those, but it unburdens your family member if something were to happen. It really does, in many instances, it has your sort of preference, what you value in writing, if we complete an advance directive. Anybody have an advance directive, if you feel comfortable? Very good. Okay. Healthcare power of attorney. What is that? Does anybody know? Yes.
This person has the ability to make healthcare
childcare decisions for you in the event that you are unable to.
Wow, okay. A healthcare power of attorney is a person who can make decisions for you if you're unable to. Now mind you, Ohio law has this covered. If we don't know this in a document, it would say that would be your spouse or legal guardian. Then it would be your spouse. Then it would be your adult children. If there's more than, they have to be a majority in agreement. But we love to know what you want and who you name with these documents. A living will, similar to an advance directive in that it does talk about if you were to become ill enough to have a terminal illness and you say, if these things were to happen to me and I was not going to recover, then I would want these things or not want these things. And then your healthcare power of attorney would abide by that. Next slide. I think this is my last slide. It's my assessment. I don't know how you all feel, but in the hospital setting, and I think I'm pretty accurate, we offer hospice. Well, I would say the hospice subject matter experts, doctors, caregivers, and palliative. Sometimes we're calling these folks for support a little late, right? Hospice is a specialized form of end-of-life care, but it focuses on symptoms rather than curing, okay? You can have hospice services weeks, months. I think insurance-wise, it's like 6 months, you can renew it. But that's if, you have something that you know you're not going to potentially recover from. Now, palliative care, I'm a very big fan of palliative care. Palliative care it's a specialized medicine that focuses on comfort and support, but it aims to improve the quality of life for the patient based on what the patient and or their family describe it as. So, we talk about goals of care. So what is my goal of care if I come in the hospital? Maybe I've had a stroke, maybe my dad's had a stroke, and what is your goal? Well, I would like, my goal is I would like to be home and sit in my recliner and have a cup of coffee. That's a goal of care, right? Now, if they say, I used to say, I want to go to Disneyland. Well, okay, let's meet you in the middle a little bit. But really, we're talking about, you have an honest conversation with your care team, and they're telling you, hopefully, in a very good and compassionate way, what you're facing, what your goals are, what your treatment options are, what your prognosis is, and this would be my goal of care. Can you get me comfortable enough to go on the golf course again? Can you get me, maybe you have COPD and the heat is bothering you, and your goal is to do that. Maybe palliative care can intervene and get you well enough to do those things you like to do. So I kind of took a little mishmash of things of what falls under my auspices, if you will, as a mission leader. So my name is Deanna Ford, like the car. Very easy to reach if you look me up in the Mercy information. I'm very connected to Catholic Charities. I'm open for questions once Nancy's presentation is over. So thank you for having me. And I hope I talked loud enough.
All right, thanks, Deanna. I'll go through my information, and then we'll be open for some open discussion. But if you have anything that comes to your mind while I'm talking, please feel free. So when we think of grief, to me, grief is a big topic. But when we think about what are some of the words that you think of that come into your mind? Go ahead.
Lonely,
Lonely,
confused,
confused, go ahead.
Someone else said it, but I was gonna say sadness.
Sadness, yes,
Emptiness.
emptiness,
Denial.
denial,
Good,
what's that?
good grief.
Good grief. There is good grief. Yeah, so all of those encompass, and all of those are some things I'm gonna stop on. When I think of it, I think of grieving. So there's grief, which is like the noun, but then grieving, the verb. Mourning, bereavement, loss, sadness, crying, upset, anger, comfort, help, getting help, consoling someone. So all of those words come to mind. So grief is a reaction to loss. It's the experience of coping with a loss. It involves that coping mechanism to deal with loss. Generally, when we talk about grief, it's associated with death as a loss, but there's many kinds of losses. Everybody knows that. What are some of the other kinds of losses?
Divorce.
I'm sorry?
Divorce.
Divorce,
Loss of a home.
loss of a home, RJ?
Employment.
Employment,
Independence.
independence, loss of independence. So there's all kinds of losses, and so there's all kind of varying degrees of grief that come with that. Most of our focus, and for today's purposes, a lot of this is usually centered around death. Death can be death of a spouse, death of a parent. We talked about Deanna's parents. I'll going to interject some things about the loss of my parents, siblings, sorry? Children, pets. What else? Friends, good friends as we get older and we see people, neighbors, different. So there's all kinds of loss and the different types of grief that come with the different types of losses. I'm going to talk a little bit about stages, types, and then just some coping and resources that would go next. So these are the most common we usually see when anytime you do any kind of research or look up things about grieving or grief. Elizabeth Kubler-Ross, the 5 stages that they talk about. When Elizabeth Kubler-Ross did her study, she interviewed people that were terminally ill. So these were kind of the stages that they were going into, anticipating what was going to happen with death. But they're very commonly associated with the stages that one goes through in grief. My kind of disclaimer to it is that there's no rules, there's no order in my mind, there's no recipe. I don't think it's linear at all. I don't think it goes like 1, 2, 3, 4, 5, because you can go 1, 3, back to 2, up to 5, back to 1. I mean, how many, and I see people kind of smiling and nodding, how many kind of feel like they've had that experience? A lot of us. But they do serve to really explain a lot of times those stages. Denial, like how did, like you just don't want to believe it. You don't want to believe that this happened. I was 28 when my dad died very suddenly of a heart attack. Shock, very big shock. Very, very big shock to my mom. I mean, it was, there's no prep for that. As opposed to, somebody that maybe has a terminal illness and you see them, you kind of have that time. When you lose somebody very suddenly like that, it's just like, whew. So, my mom, I mean, we got through it. We were with her. Felt like we were coping, felt like she was coping. On the 1-year anniversary of my dad's death, she said, well, I guess he's not coming back, right? 1 year. That was a shock to me. I mean, I'm getting like chills because I knew she knew it, like we knew it, like we knew he was gone, but it took her 1 year to say, okay, he's not coming back. Like, no. To me, that was kind of that denial, even though it was, we probably moved down through and had accepted he was gone. but that was sort of the stamp in her head where can't deny it any longer. So anger. And again, like Deanna said, I don't want to trigger anybody, but so please take care of yourself in this. But how many people have lost somebody and you're really ticked off at them?
At them?
I mean, it happens. It's very true. When my dad died, I mean, we were, it was hard to admit that though. It was kind of hard to admit that you're mad. Like, why didn't they take care of themselves better? Why didn't they do this? Why didn't they go to the doctor? I have stepchildren who lost their mother very young, and she had a liver issue that she should have had addressed, probably could have had cured. Didn't go, didn't want to go to the doctor. They were mad. I mean, they were mad after, like she could have done this. So that's a very normal response. The bargaining, a lot of times it's, a lot of times that's in anticipation, but, bargaining is, oh, maybe if I would have done this, or, if I could have changed this, or, something along those lines. Depression, very, very common. Depression is normal. There is very normal phase of depression. It's sadness, it's weepiness, it's missing people, it's sometimes shutting down, it's sometimes just not being able to cope. Depression is very, very common, okay? So we're gonna just talk about very common responses for a minute. And then acceptance. Acceptance is kind of that final point of like, you kind of get to a point where it happened, like my mom, he's gone. Acceptance doesn't mean you're over it. It's not like you shut the book, the end, and now we're done and everything's hunky-dory, right? Acceptance is you live with it. And I'm going to talk about that in a minute too. But again, no rules, no real recipe. It's not a 1, 2, 3 thing. So types of grief. I typed in, if you've ever go on the internet and type in types of grief, you're going to find so many things, everywhere from the 50 types of grief to the 5 types of grief. I mean, so there's all kind of ranges of different types of grief. I kind of shrunk it down for today just on these. Simple or normal grief, and I use normal very loosely. As Deanna said, everybody's response is unique, but you can expect normal grief is sadness, grieving, some withdrawal, depression, changes. Simple normal grief is a very normal phase. The American Psychological Association says normal grief is anywhere from 6 months to 2 years. I don't believe it. I think you can't put a timeline on it, but I think that that's kind of what they feel is sort of a normal grieving period. You see a lot of times people talk about the 1 year mark. I don't know if you can really put a timeline on it. I think it's a gradual, it's phases. Sometimes it's, sometimes you're doing great and then you're in the car and a song comes on and it triggers something, right? It triggers something. I remember when my dad died, 20 years after my dad died, one brother was getting married and my other brother stood up to do the toast, and he got like half the first sentence out of his toast, and he and I and my other brother all ran out of the room of the reception because it just, all he started to say was, that we miss those who aren't here, and we all 3 of us triggered. We left the room, left the reception. The reception was like, okay. The groom and the best man just left. And then we went back in. We had to collect ourselves, but it triggered. So how many people have been through something where you had a trigger? Anybody comfortable enough to share maybe something? Go ahead.
I lost, and I work in the death care industry, but I lost a friend at 16, which was a very traumatic experience for all of us involved. And for a long period of time, I lost my friend October 28th. I would have memory loss in September and October. There would be compartmentalizing, so I wouldn't actually know what I was upset about. I would be moody, I would be angry, lashing out at others, lashing out at work. And it's only within the last few years that I've been able to like approach that time frame and not be triggered in that regard and be able to actually know why I'm getting upset. And it took a lot of therapy and work to be able to
Yep.
realize what those reactions were, because your body just automatically reacts when it's a trigger.
Sometimes it's a song, sometimes it's an event, sometimes it's the date. We know people that, you know, have lost a child, and when that anniversary date's coming up, she's like, I won't be at work, can't do it. It's gotta be like, you know, there's just certain things that you have to recognize. Anticipatory grief, kind of what Deanna was referencing through hospice and palliative care, that's kind of preparing yourself. That's when you have the opportunity to kind of anticipate and prepare for what's going to happen, as very opposed to someone who loses someone very suddenly. Complicated or prolonged grief, something that is also through the American Psychological Association, they call it prolonged grief disorder. This is when things can be very intense. Complicated grief, it's just defined as experiencing symptoms of grief that continue for over a year after a loss. You may feel intense emotions or have trouble accepting the loss. It can affect your physical health, interpersonal relationships, daily responsibilities. Cognitive behavioral therapy is sometimes very recommended for this. Complicated grief is intense sorrow, pain, rumination over the loss, focusing on little else other than that, extreme focus on reminders. It's an intense, persistent, prolonged pining, and a problem with acceptance that disrupts your life. So if you know somebody who completely, you know, their life completely changes, they're not dealing with, you know, honestly, really life, they've completely shut down. This is more of what we call complicated grief. Sometimes complicated grief, you may have somebody who already has maybe some coping issues or anxiety issues or things even before this, and this event, this loss, may complicate that even further or exacerbate it. Disenfranchised grief, I wanted to mention this. This is where your grief maybe isn't as validated and sometimes makes it tougher. Sometimes pets, sometimes people hear about, like if you're not a pet person and you hear somebody talk about losing their cat or their dog and they're grieving, you may kind of be like, oh, it's a dog, like, you know. But if you ever have a dog that you lost, like, you know that it's real. The grief is real. Sometimes people in the LGBTQ community, if they lose a partner, people downplay that, like, well, you know, like they weren't really your, I mean, you know what I mean? There's like, they can feel that they really can't appropriately, or maybe openly grieve. It can also be perinatal loss, if you've had a miscarriage, or if you lose maybe a pregnancy. You know, sometimes people are like, oh, well, you know, you'll get over it, or, oh, you know, at least you could get pregnant. I remember I had a miscarriage and early on, and somebody said that to me, and I thought, I just can't stay pregnant then, I guess. So, you know, sometimes you get that disenfranchised because you feel like people are downplaying like you. Sometimes it's loss of a loved one who's not blood related. Maybe if you lost like your friend, that was very real. Losing a ex-lover, or maybe an in-law that maybe you're not related to, and you lose them, and that's still real grief for you, but other people may downplay that. So I just mentioned that, being careful when you hear of somebody who has a loss that's maybe not immediate, it's very real still. And then there's collective grief. Think about like maybe a public personality. Think about, I'm dating myself now, like when John F. Kennedy died, or when Martin Luther King died, or when we hear about like a celebrity, and there's kind of this collective like kind of grief where everybody's like,
I was gonna say a school shooting or something like
there,
that.
that's another good example, like a school shooting where we hear about, or you know, some of these mass shootings that occur. Just hearing about some of the loss from the bombings like in Iran and Israel right now. I mean, there's that collective grief where we feel those things. So there's many types of grief. There's many types of grief in the writings and many kinds of different types of grief that you can experience. So the right time frame. I mentioned this kind of already. I don't know that there's no recipe, there's no playbook, there's nothing where you can say, okay, this is how I'm gonna feel today, in a week from today, it's gonna be like this. What's normal for someone may not be normal for someone else. I know like people that have lost spouses who never get into another relationship again ever. Whereas I had a relative who lost their spouse after a very long illness. 6 months later, she was dating and was okay. So it's everybody's time frame is different. Normal grief, we see the improvement of symptoms. We see that the coping is getting better, but understand again, and I think I said this, that you're never done. You're never done with it. How many know who Blake Shelton is? He's a country singer. He wrote a song called Over You years ago. It was about his brother who had died in an accident when he was 14. Older brother looked up to him, and I remember I read this article where he said his father said, it's not something that I'm ever going to get over, but I'm just going to get through it. And that really stuck with me. So you never get over it. Like people say, oh, you just need to get over it. You need to move past it. You're never going to get over it. You're never going to put it away, but you're going to get through it. And people get through it in different ways. So when I hear things about closure, sometimes you see this with criminal, like if there was a criminal, like a murder or someone, and they say, well, when you went to court and they got convicted, did you have closure? I'm like, I always cringe when this media asks that question, because to me, I think they're asking like, are you okay now? Like, it's all over. He got convicted, so it's all good, right? It's not. You're not over it. I wish I could remember exactly. I heard Father Popovich talk about this once, how grief is something that is always going to be like a thread through your life. So when you talk about words like closure, I always just kind of cringe. You can't expect to be like done, but sometimes you just get to a point where maybe you're okay. It's still there, but you're going to be okay with it. How to cope. Self-care. Deanna mentioned this, taking care of yourself. That's the first and foremost thing. You got to figure out what is the right thing for you to be okay. Is it sitting in your house and leave me alone for a while? Is it I need to be out among people, I need to get back to work, I need to not go to work? It's that self-care, how you take care of yourself. Rest. They talk about try to keep a routine. Go to bed the same time, get up, have your routine. Try to maintain kind of a routine that contributes to your self-care. Reaching out to others. You got to find what works for you. I'm going to talk about some resources in a minute, but just finding out who can you reach out to, who's your support. And if it's not somebody that is a relative or a friend or a colleague, it might be a therapist, it might be somebody, it might be a religious person, it might be somebody that you feel that you can go and reach out to about it. It's okay to cry. Sometimes people feel like, oh, they get upset because they don't want to see tears, but tears are okay. I told Deanna this story, I'm going to tell it. Years ago when I was a social worker in the hospital, I covered the cardiac intensive, and we had a gentleman come in who had had a massive heart attack. Italian, huge family, bunch of adult kids, bunch of relatives, and there was probably 15 people crammed into this little room, and they had basically told them that he really was not expected to make it through the day. He had had a massive... The nurses called me as a social worker and said, that they're all in there crying. I'm like, yeah. Can you do something? I was like, yeah. So I went in, I gave them my condolences, I shut the blinds, and I shut the door, and I let them stay in there so that they could grieve and cry, because that was normal, right? They had been hit with the devastating news. But the nurses had gotten very There was so many of them and they were very demonstrative. Like, you know, as Italians, we can be like very demonstrative. So it's okay. Talking, journaling is a big thing. Praying, seeking solace in prayer. Some of the local response, I wanted to kind of look up what some of the churches in the area are doing. Holy Family in Poland actually had listed on their website a counselor's name that you could go to. They also talk about a number of the churches have support at funeral homes, so they send people to the funeral home. Many of the churches are doing mercy luncheons. St. Michael's has a bereavement luncheon ministry. So does St. Christine's. So does St. Teresa of Calcutta up in Warren.
They also, just so you know, I work at Also Cemetery. I'm one of the family service advisors there. They actually have a bereavement counselor there
At
the St. Teresa of Calcutta campus.
up in Warren, yes.
And so they do sessions every couple weeks.
Some of the churches will help you with funeral planning. St. Rose and Gerard actually has a 22-page funeral planning guide with suggested scripture, suggested songs, suggested prayers. It's really actually really cool. I know St. Luke, I know Deacon Silly said that Sister Regina will sometimes help with planning. And most of the churches will help you along with the funeral homes, but there are some responses to what the churches can offer. Some of the other resources to think of, again, the funeral homes. I know that Higgins Reardon Funeral Home has a pastoral counselor, Sister Pat Fessler. I don't know if she covers any other funeral homes, or I don't know, but so if anybody knows this, but if anybody, the other funeral homes offer a pastoral counselor. I know after my mom died, I went to talk to her. Took just one time, but it was enough that I got to just talk out some things. The healthcare system has different resources, especially hospice. They have some follow-up, and you don't have to have been involved with hospice to go to their groups or talk to their social workers. Some of the churches, again, like I mentioned, the Catholic funeral and cemetery services, that's where you're at.
Yeah.
They offer some, that's where you guys are at?
Yeah, she's at Calvary, and I'm at Also Cemetery.
Okay, and you offer, I think, support services, different, do you want to say?
Well, that's really what we're here, because we don't have a specific program or offering, so we're anxious to put something together to offer our families once their loved one is buried with us.
Okay.
A lot of our support is individual support. A lot of the support happens on a one-on-one basis, so we're very close with our families, and we provide even like after work hours support a lot of the times, emails, phone calls. We have a lot of families that will come to us up to 2 years after the loss and need to speak and things like that. So it's always the support there, but we are looking to formalize a program for sure.
Great. And I don't know if everybody heard, but the Catholic cemeteries are all looking at different resources that they can provide also in their ministry. Again, family, co-workers, there are support groups. There are support groups for a lot of different things. So if you lose a child, if you have a loss from pregnancy loss, if you have, there's a support group out there for people that have lost somebody due to drug overdose. So there's some different resources. You can call our office, you can check with 211, they have a database where they keep track of some of these things. And then there's a multitude of different individual and family counseling agencies. Frequently we'll get a phone call that'll say, do you have a Catholic counselor that I can go see? And we do know some counselors who also happen to be Catholic, but they're also they're gonna come at you from a counseling standpoint. Sometimes people are looking for different things when they're asking for Catholic help. Sometimes that's maybe better through a religious, because they're looking for probably more spiritual. Pastoral care though is also something, but looking for more spiritual answers. What happens after I die, where, just some of those things. Brianne? I think that's it. I think that's the last thing I have. So, let's see if I missed. That's basically, I'm gonna stop there. Deanna, I don't know if you wanna come back up. Does anybody have